Hello, myself Kushi Kotecha and today I am here to talk about the PT treatment of spina bifida. First of all, what is spina bifida? Spline is a developmental congenital disorder caused by an incomplete closing of a neural tube and overlying posterior vertebral arches. Generally, at the end of 21 days of a gestation, the neural tube is closed. But in some children, the caudal end of a neural tube or a primitive spinal cord fails to close before the 28 days of gestations. Now, what are the types of spina bifida? There are two types of spina bifida. First is spina bifida occulta and second is spina bifida cystica. Spina bifida cystica further divides into two, meningocele and myelomeningocele. Now I will talk about the plan of treatment. First, we have to prevent or correct the deformity, maintain or improve the physiological properties of joint and muscles, monitor the normal motor developments, educate the parents or caregivers, encourage and maximize the independent mobility, and encourage the participation in regular physical activities. Now, what is the treatment plan of spina bifida? Children with spina bifida do not move easily by themselves due to loss of feelings and muscle strength in the legs and arms. As child develops, physical therapist monitors the joint alignments, muscle imbalance, contractures, postures, and sign of progressive neurological dysfunctions. First, I will talk for standing and walking and maintaining the mobilities of hip, knees, and feet is crucial. The position of feet could have been improved by the mobility exercise from beginning. Now, how to achieve optimal mobility? In newborns move spontaneously immediately after birth, but child with spina bifida needs your help to move from very beginning. For patients who are predicted to ambulate, the pre-gait training should begin with the use of parapodium or a walker. Exercise or household distance ambulation may be pursued with the use of leg brace like hip, knee and foot orthosis, knee ankle foot orthosis, etc. Now I will talk about the motor development. In motor development, we can help the child in three different ways. First, by stimulating the motor development, maintaining the joint mobility, and positioning the child in the right way. First, how to stimulate the child. In stimulating motor development with activities such as rolling, crawling, sitting, standing, walking. All these are the different activities. Rolling is the first step in moving around, in which gives the child opportunity to change the position. We have to slowly stimulate and flex the knee and helping them in moving the sideways. By contact play with child, we can also stimulate. By giving different textures to the child, we can also stimulate. And by sitting safely, we can also help. Next step is crawling. First, child can cross symmetrically with two legs, and next step is alternate crawling, in which the child moves leg by leg. This is the summary of stimulation. Now I will talk about maintaining mobility. Full range of motion from the flexion to complete extension of hip, knees and feet is needed for standing and walking. Do it at least 10 times and hold it for 2 seconds. For mobility of feet, we need to do flexion and extension of foot. Do it 10 times. Do this mobility exercise several times per day. Mobilize the hip. Pay attention in the extension of hip. Child will be in side lying position and flex the pelvis with one hand and with other hand move the leg backward. Do it 5 times with flexed knee and with stretched knee and keep hold it for 2 seconds. After 10 repetitions, change the side. After mobility exercise, lie the child on a belly. Prone position is good for a hip mobility of child and developing the strong muscles of neck and back. This is the summary of maintaining mobility. Now positioning. Positioning the child in the right way when lying, carrying, sitting will help the child feel comfortable and prevent the complications. Lying position. Use the mid-back side lying position is more comfortable and the wound can heal. Roll up 2 or 3 times. Change the side frequently to prevent the bed sores. Place and maintain the child in prone position. Hold the infant in the prone position that provides the sac is protected. This is the summary of position. This is all about the PT treatment of spina bifida. Thank you.